having Ali Morgan and Joe Hannell present the Healthcare Halftime Report, Controversies, Collaborations, and What's Ahead for the 2015 legislative session. So before we go over, the first is how to ask your questions. So there'll be plenty of time for questions at the end, and we encourage you to ask those questions. And the way to do that is there's a sort of a chat function in the webinar box called questions, and you can type them in there, and I'll pass them along to Ali and Joe and have them answer questions as they come in. The second is that this webinar will be recorded, as well as the slides will be put up on our website. So you can share it with people afterward, or if there's something you want to go back and listen to, it will be recorded. And the last is just a special thanks to our funders, the Colorado Health Foundation, the Colorado Trust, Caring for Colorado Foundation, and Rose Community Foundation. With that, I'm going to hand it over to Ali and Joe.
All right, thanks, Tasia. My name is Ali Morgan, and I'm a policy analyst at the Colorado Health Institute, and I also serve as CHI's legislative liaison when the General Assembly is in session.
And I'm Joe Hannell. I'm a communications expert here at CHI.
All right, and we would like to thank you all for joining us today for this webinar, which we are calling the Healthcare Halftime Report. We do realize that it's a little bit past halfway of the session at this point, but we really just wanted to do a mid-session look at what we've seen and the preview for what we see coming. So now that it's mid-March, this is a time of blooming flowers and sunshine, except for today when it was snowing outside. And whether or not you're a sports fan, you also know that March is a time of basketball and brackets. And so we decided to have a little bit of fun with this presentation today, really embrace the March Madness theme and go for a little bit of a basketball spin. So what we'll be talking about is what we're calling our first half stats, so what we've seen happen with some of the healthcare bills that we've been tracking, talk about some lessons and themes that those have taught us about this session, talk a little bit about the budget, because we know that's very front of mind for everyone at the moment, and then look ahead a little bit to the summer. So here are our three key takeaways for today. First is that health bills about efficiency are winning or passing. And we've seen so far that legislators love the idea of efficiency and improving value in healthcare, and that as long as the bills or issues aren't overly controversial, these types of bills are doing very well and have had a lot of success so far. Second is that health bills tied to social issues are failing. So if you haven't noticed, the culture wars are far from over, and this applies to a lot of areas outside of health, but we've seen it exemplified in the healthcare bills we've tracked as well. And then third is that you should get ready for a full court press on the budget. Health spending is a growing part of the budget, as we'll discuss later. Our state legislators can't fund everything that they would like to. The Taxpayers' Bill of Rights, or TABOR, is a looming issue, which we'll also touch on later. And so big decisions are coming with our state budget. So I'm going to turn it over to Joe now, who will go over some of the bills that we've been watching this session.
All right, well, there's still a lot of time left in the session, but we've already seen some first half stars, some bills that have hit the mark. First of all, it's worth noting that everything that passes this year needs at least a little bipartisan support. We and a lot of other people noted this at the beginning of the session. But in practice, at least the healthcare bills that have passed have tended to have really overwhelming bipartisan support. There's very little that's just barely squeaking past and making its way to the governor's desk. First among these successful bills was the telehealth bill that Governor Hickenlooper recently signed. It requires insurance companies to pay for telehealth services in large urban counties the same way they currently have to pay for telehealth in rural counties. A bill to cut red tape around the donation of unused and unexpired medications has passed. The idea behind this is to cut spending on drugs by reducing waste of medications that are perfectly good and unexpired. Performance audit of Connect for Health Colorado. This bill a bill like this was introduced last year, and it failed. But right before the session, there was a very concerning fiscal audit of the marketplace. So this year, the larger performance audit has easily passed. And last one I want to highlight is Senate Bill 53. And it would allow first responders and friends and family of people with drug addictions to get advanced prescriptions for emergency anti-overdose drugs. These drugs can be life-saving if they're administered quickly, and importantly to legislators, they are not addictive. Not everything's been a layup so far this year, though. We've seen several block shots. First, a bill to require legislative approval for bonuses for Connect for Health Colorado employees passed the Senate, but it failed in a House committee. And that's going to be a familiar pattern for the rest of the year because of divided partisan control with Republicans in charge of the Senate, Democrats of the House. Bills that narrowly pass one chamber or just get somewhat soft bipartisan support in one chamber, they're going to face their hardest tests in the opposite chambers first committees. That's what happened to the Parents' Bill of Rights, Senate Bill 77. It would have given more rights to parents to decline vaccinations, remove their kids from school curricula that they objected to, and it would have required explicit permission in advance for schools to administer health surveys to kids, such as the Healthy Kids Colorado survey. That passed the Senate, died in its first House committee. The physician-assisted dying bill, with supporters call it death is dignity, it didn't make it out of its first committee hearing in the House, but it was a long, very emotionally difficult to listen to hearing, and it drew some of the most media attention of any bill that we've seen so far this year. And finally, House Bill 1143, that proposed tax credits to finance home upgrades for people over age 75 to upgrade their houses so they could stay home instead of moving into nursing care. The Health Committee really liked the idea behind this bill. It passed its first hearing, but it failed in the House Finance Committee because there was a pretty steep price tag on it. Now we take a look at a very tense University of Kansas bench. Unfortunately for Jayhawks fans and my tournament bracket as well, nothing remains to be decided for the Jayhawks this year. However, the year is still young for health policy and there's still a lot up in the air. One of the biggest remaining bills we're tracking is Governor Hickenlooper's request for $5 million to pay for what's been a very successful program that provides long-acting contraception to low-income women and teenagers. The program had been grant-funded, but the grant is running out. In the years that it's been in effect, though, it's made a big reduction in unplanned pregnancies and abortions among women who've used the program. And it wouldn't be a Colorado legislative session without some marijuana bills, and the big one this year is Senate Bill 14. It makes a lot of updates to the medical marijuana code, but the biggest change would be a tighter regulation of caregivers. These are people who can provide marijuana to people on the medical registry outside of that tightly regulated retail setting. Now, that's important because it's really becoming a state priority. The state regulators estimate roughly a third of the marijuana sold in Colorado last year came from this very lightly regulated caregiver market. And getting a handle on that part of the market is really a top priority for regulators now that the retail marijuana for both recreational and medical, now that that regulation system seems to be set up and functioning fairly well. So time is long run out on the first half, but we hear there might have been some late shots launched and they could be coming down soon as late bills. First of all, there's a dental bill that would give hygienists the authority to put in temporary fillings. You might sometimes hear this referred to as a teledentistry bill. And that's because dentists would use telehealth technology to remotely oversee hygienists when they're putting in fillings. Senator Aguilar and Representative Janal have talked about trying to refer a measure to the ballot to create something called Colorado Care. That's essentially a universal health system for all of Colorado. It would need approval from the legislature to put it on the ballot and then approval from the voters to actually go into effect. We'll talk in just a minute about this hospital provider fee. But the last item here, Senator Aguilar has talked about this out-of-network cost issue. this is about patients visiting a clinic that's in their insurance network, and then unknown to them, they're being seen by an out-of-network provider at that clinic and getting stuck with a higher bill. We're not sure if this is going to result in legislation this year, but there have been some pretty intense discussions about it. So that's my play-by-play. I'm going to turn it over now to Allie for some color commentary, and she's going to tell us what's been working for the legislators so far this session and what hasn't been working so well.
Great. All right, so we don't want to just give you a list of bills by status and leave it at that. Many of you listening are probably familiar with many or all of the bills that Joe just went through that we've been tracking. So what we want to do now is kind of look at some trends and findings that we've pulled from those lists. So here's the method to our March Madness. First, when you look at bills that are passing, most of them in terms of healthcare really have to do with this idea of doing more with less or working to increase value in healthcare. And this really falls into two main buckets. The first is about increasing efficiency. Some examples of bills we've seen in this area have been the telehealth reimbursement expansion bill that Joe mentioned, and also a couple to remove red tape on donating and substituting medications. Our second bucket is really around expanding scopes of practice, often tied to this idea of allowing professionals to practice at the top of their license, which should hopefully alleviate some access areas in certain areas of Colorado. And some bills we've seen in this realm have been a bill to allow naturopathic doctors to treat very young children, which they weren't previously able to do, a bill to expand the types of professionals who can provide mental health treatment to minors 15 and over. We've also seen several bills that deal with the scope of practice of nurses. One about certified nurse aides has already passed, and then one about advanced practice nurses and their ability to write prescriptions is in progress. It's passed its first chamber. Then we have some bills that are generating debate and have generally passed or failed on a case-by-case basis. First, we have these bills around the role or appropriate place of government. Bills have really gone both ways here. Some have passed and some haven't, but it's been a big issue either way. You can look at the Connect for Health Colorado audit bill, as Joe mentioned, that passed easily this year with overwhelming bipartisan support, but a bonus oversight bill for the same marketplace failed. We have an existing bill for the long-acting reversible contraception also that Joe mentioned. That's still alive, but it's very contentious. The question is if that's a place for government funding. And also the Parents' Bill of Rights that Joe mentioned, which failed, which is tied to government regulation. Then we also have this issue of balancing costs and consumer benefits, which is a big issue that many bills have attempted to address so far this session. The question is really, where does the legislature draw the line on paying more to increase health benefits for Coloradans? So bills under this area are the Autism Parity Benefit Bill, which did pass, the tax credit bills for practicing in underserved areas or training in progress, the bill to provide tax credits to older people to stay in their homes, which failed, a Medicaid rider rate bill that already failed, but we do have a new bill introduced, Senate Bill 228, that would tackle that rate review process again, and also a pharmacy choice bill that failed. So this is something that legislators have really been wrestling with so far this session. Then we have our bills that really have not made it through, and these have to do with partisan issues or social issues. This has really held true across the board with few exceptions in the legislature this year for health and other topics. And we've seen a very split legislature with pretty different ideological views, so this hasn't been very surprising to us. You can see that anything that is a remotely partisan issue has not made it through so far this session. If you look at the Connect for Health Colorado bonuses bill again, a bill was introduced to completely repeal that state marketplace, and that's not the first time we've seen that bill. Another bill to contingently repeal the ACA in Colorado if it's repealed at a national level by Congress. So none of those have made it very far. Then we also have bills that are perceived to be social or cultural issues or have been tied in some way to a culture war issue. These include some abortion bills, one about teen pregnancy prevention and dropout funding, the physician-assisted dying or death with dignity issue, a bill to create a statewide registry for advanced directives, and then this idea of parental control that we saw in the Parents' Bill of Rights. Something interesting that we've seen is that some of these issues may have suffered from being linked in some way to more difficult or controversial issues, while they wouldn't have been as controversial on their own. This we can see, for example, in the Teen Pregnancy Prevention Bill, which still in its own right is controversial, but may have been linked to things like abortion or contraceptive funding. We also just have some members of the legislature who are simply philosophically opposed to these issues. And so in such a closely divided legislature, these types of bills are just really not making it through. Then we have our free agents, which are issues that are returning or we expect to see return next year. In the meantime, they are gaining media attention, biding their time, waiting for a new team and a new chance next season. So here are some issues that we expect to see returning as future bills or potentially as ballot issues, likely in 2016. We don't expect that Colorado's insurance marketplace, Connect for Health Colorado, or the Affordable Care Act are now free of attempts to more tightly regulate or repeal them. This is just an issue that many people feel passionately about, and we don't think this is going to go away. We have this physician-assisted dying issue, has a very committed group of supporters behind it, as well as a very passionate group in opposition, among them a lot of disability advocates. And so this is likely to return to the legislature in a new bill or go straight to the ballot. And so this is something we'll certainly keep an eye on. The hospital provider fee is a big part of addressing TABOR. Again, I'm going to let Joe tackle that later. What you need to know at this point is that while it's somewhat of an issue this year, it's going to be unavoidable in future years. And assuming that TABOR is not addressed to everyone's satisfaction in the next 2 months, which we think is pretty unlikely, this is not something that's going to go away anytime soon. And then Joe also mentioned this potential forthcoming piece of legislation, which would essentially provide universal coverage to Coloradans. We had a similar effort fail to pass the legislature in 2013. And the sponsors here may have the option to run their idea as a citizen initiative and bypass the legislature altogether. So this is something that we'll be tracking as well. So we like to turn now to the budget because, again, we know that this is right in front in a lot of people's minds at the moment. The long bill is going to serve as an indicator of whether we're aiming for a Minute Bowl-sized government or a Muggsy Bogues-sized government in the state of Colorado. The long bill will be introduced any day now, and that budget will be debated, we expect, next week. A process overview, just quickly, the Joint Budget Committee has been working on this budget since November. Each year, the chambers alternate which one gets it first. It's up first in the Senate this year, and then we'll go to the House. A revenue forecast was released last week, and it gave the JBC members kind of the final idea of how much wiggle room they were going to have in that budget. And so at this point, some pretty limited funds remain for any line items, including for health, that did not make it into that version of the long bill. We understand that about $5 million is probably up for grabs in each chamber at this point to fund anything that's not included or hasn't been spoken for. And then just to provide some context, we wanted to talk about health as a part of the general fund and how that's changed over the years. So you can see that the Department of Healthcare Policy and Financing, or HCPF, is highlighted in the orange section here. And you can clearly see how much that has grown from 2000 to the projected next fiscal year. You can also see the Department of Human Services at the bottom, which does deal in health. And so health just takes up a significant part of our state budget. We do want to note that the population of Colorado increased by about 1 million people during this time span. The stock market's also grown by 50%, so this isn't a completely apples-to-apples comparison, but we think it's important to note as you consider the role that healthcare is playing in the state budget. As you know, HCPF is the department that administers the state Medicaid program, so much of the increase has been driven by growth in Medicaid spending during this time. And then we just wanted to quickly look at a kind of budget growth snapshot for these state health departments. This is based on the governor's request in November. The numbers may be slightly different in the upcoming long bill, but this is what we have at this point. So the Department of Public Health and Environment is on the left. They are projected to see just a very small 0.5% 10% decrease in their budget from this current fiscal year to the upcoming year. That's a little bit misleading because this department was a conduit for federal flood relief funding after the flooding in 2013, and we luckily didn't need that money again the next year. So this is a pretty steady department budget for CDPHP. DHS is similar. They're seeing just under a 1% projected increase. This department administers a lot of behavioral health services and several others that are related to health. And then we have the Department of Healthcare Policy and Financing on the right, and that's a different story. You can see that that budget is projected to rise almost 10% from the current fiscal year to the upcoming fiscal year. This is due mainly to a higher Medicaid caseload that's projected to increase about 22% from this year to next year. And we've heard that that's driven especially by the eligible but not enrolled population and what's called the welcome mat effect. So getting more of them aware of the opportunity to sign up and potentially seeing some gains in signups from that population. And so that's something we can discuss more during the Q&A period if you're interested. And finally, I just wanted to touch on a few highlights from the Joint Budget Committee's figure setting process. The JBC is in general pretty supportive of health requests, especially from HCPF during their budget setting process. So here are some things that we saw among many others. The JBC approved a request for 25 new full-time employees to staff HCPF's Medicaid call center. We are seeing a large increase in the autism line item, about $9 million over the next 2 years, which would eliminate the wait list for children to get services and also expand eligibility for some older children to get those services. Then we have this recommended switch from monthly income to annual income to determine Medicaid and CHIP eligibility. This is something that actually was not recommended by the JBC staff, but the JBC decided to vote on it anyway and did approve it and add it to the long bill. And so what this would do is help several groups, especially part-time and seasonal workers, gain some continuity in their eligibility for these programs so that they wouldn't one month be eligible for these based on their income and then the next month suddenly wouldn't be. So the idea is that this should help to reduce churn. And this wouldn't take effect until fiscal year 2016-2017. Then in addition to some 0.5% provider rate increases for Medicaid, which are across the board, the JBC is also recommending some higher targeted rate increases for Medicaid providers. They are adding nearly approximately $1 million in new funds to the Colorado Immunization Information System and are also recommending some unrestricted core services funding for the local public health agencies. So now Joe will go over this little budget issue that people have been talking about.
That's right. That is the Taxpayers' Bill of Rights. Notice our elephant picture here. We're calling it the elephant in the room. Among all the wonders that the internet has brought to society, it also makes it shockingly easy to find a royalty-free picture of an elephant playing basketball. So whoever in Thailand uploaded this picture and is letting me mix my metaphors here, thank you very much. Well, Tabor, as most of you know, is the revenue limit, not a spending limit, but it's a limit on state revenue. And it limits revenue to a formula based on inflation plus population growth. Money over that Tabor limit has to be refunded to taxpayers. There's been just one very small Tabor refund in the past 15 years. But that all changes this year. Based on last week's revenue forecast, you can see the projected refunds up on this slide. They do indeed begin this current budget year. These are the Legislative Council's predictions. The Governor's Budget Office has some slightly more conservative predictions, meaning larger refunds, at least in the early stages here. So as we're about to see, healthcare is starting to play a really big role in Tabor discussion, and that's because of something called the hospital provider fee. So the hospital provider fee was enacted to finance an earlier expansion of Medicaid and Federal Health Plan Plus during the Ritter administration. This was prior to the Affordable Care Act, and this is an expansion earlier than the big Affordable Care Act expansion that we're all familiar with. The provider fees, the charge on hospitals that goes into state accounts where it draws a federal match in Medicaid money. And then it's used to finance that Medicaid expansion, and hospitals get a good part of the rest of the money back plus the federal match. So hospitals tend to think it's a very good deal, and it's also enabled a lot of people to join Medicaid even prior to the Affordable Care Act. Now, provider fee revenue is subject to TABOR, and it's a pretty big amount of money we're talking about, on the order of $600 million or $700 million. With hospitals are getting most of the benefits, but it's the general fund that needs to pay the TABOR refund. And from a budgeting perspective, if there were no TABOR refund, there would be more money available in the general fund for education and other priorities. This graph on the slide comes from the Colorado Futures Center at Colorado State University. And the center estimated earlier this year that without the provider fee, there would be no TABOR refunds all the way through the year 2030. That's what this graph is showing. The blue and orange bars show TABOR revenue with the hospital provider fee. The gray and yellow bars show revenue subject to TABOR without the provider fee, and the jagged blue line's the TABOR limit. You can take a look at it. That gray and yellow bar never gets above the TABOR limit all the way through 2030. So if the provider fee somehow were not a factor, we would not be talking about TABOR, and neither would our kids. So we're expecting to see a bill from Democrats this year that would reclassify the hospital provider fee as not subject to TABOR. We're also expecting that Republicans are going to fight this change. One thing, though, we think is certain: if the bill does not pass, future conversations about TABOR are going to include the hospital provider fee more and more, and TABOR is inescapable. So that's our wrap-up of the session so far. Our themes here are the winners this year. The bills are all about efficiency, doing more with our existing resources and our existing workforce. Bills that are even remotely related to social or partisan issues are losing. And health spending is becoming a growing part of the budget in the general fund, and it's increasingly tied to TABOR. Big decisions on that front are looming. We're about to take questions, but before we do that, there's one more wild card in health policy that we want to bring to your attention, and that's the King versus Burwell case. The Supreme Court heard oral arguments in this case on March 4th. It's a lawsuit that argues that the subsidies that people in 34 states receive to buy health insurance through the Affordable Care Act are illegal because those states use the federal marketplace. And the plaintiff's claim is that the plain language of the Affordable Care Act allows subsidies only on states that have established their own marketplace. Colorado is one of those states that established its own marketplace, Connect for Health Colorado. So well, we think otherwise, though. We sponsored a panel the issue that what they told us is that some audio interference there, that some of the issues also, there are some smaller ways the insurance for the plaintiffs, we think, would make it imperative for the something to rescue insurance markets in those 34 states. An estimated 8 or 9 million people lose their subsidies. So a decision is expected in June, but we think this is a case that really bears watching, and I'm happy to talk about it more during the Q&A period.
Great. So just before we take questions, we'd like to thank you all so much for listening to our webinar. Remind you that CHI is a year-round nonpartisan resource. We're available for information requests and publications. And we also release publications like the Legislation in Review, which our 2015 version should be expected by early June. That will basically be a more robust and polished version of this presentation. We'll be able to give you a final verdict on the state of all of the healthcare bills that we've been tracking and see if they fit neatly into the buckets and trends that we've identified. So now we'd love to open it up for discussion, explain the Q&A portion.
So if you can see, I don't know if it cut out for some people in there. I apologize if that happened. You can see the question box is about second from the bottom in your chat function. So if you have any questions, go ahead and type it there. And then Allie and Joe are happy to answer. We haven't had any questions come in yet, so if you have any burning questions, go ahead and send them in. But Allie and Joe are also available anytime by email. I think Allie just mentioned that. So you can also ask questions later on.
All right, we're still waiting for any questions, but apparently the audio cut out, at least for some people, during our King versus Burwell slide, the last slide that we did. So just want to clarify again what that case is all about. It deals with subsidies that people in 34 states get to buy insurance on the federal marketplace. The plaintiffs are saying those subsidies are illegal because there's a passage in there that seems to limit subsidies only to states like Colorado that have set up their own state insurance marketplace. And because of the way the complaint is written, people think that, a lot of people think there will not be implications for Colorado because we do have Connect for Health Colorado, and anyone who's getting a subsidy here would continue to get it. But we think that it's not quite that simple, that there are legal and financial and political implications for the entire country, even Colorado. There are several ways that a victory for the plaintiffs here could affect our insurance market in Colorado and the Affordable Care Act nationally. And the big one really is the political pressure the Republican Congress and President Obama would be under to find some sort of solution that for people losing their subsidies in those 34 states. The estimates are 8 or 9 million people would lose subsidies, and it could have a fairly profound effect on the individual and small group insurance markets in those states. You would still have an individual mandate in place to buy insurance. However, a lot of people would not be subject to that mandate without the subsidies. The insurance companies, though, would still have the guaranteed issue requirement. They would have to issue insurance policies to anyone who asked and was willing to pay. And that could result in really only sick people going to buy insurance. You would have an actuarial death spiral is what the insurance companies are calling it. So this is a pretty major case. We think it bears watching. We're looking for a decision in June, perhaps the last day of June.
Great. So again, if anybody has any last-minute questions right now, this is Allie, about either bills we mentioned, the budget, or the King versus Burwell case that Joe just discussed, we'd be happy to take those now, or please feel free to email us. You can see both of our email addresses at the bottom of this slide right here, and we would be happy to respond to your questions.
And you can find that on our website, which is coloradohealthinstitute.org. That's coloradohealthinstitute.org. Thanks, everyone, for joining us.